Hello, I am Jay Wings, or Jill. I have a degenerative disc disease and spinal stenosis. I also have mental health disabilities. I have found a supportive home here at Virtual Ability and many friends and lots of educational opportunities. I am grateful for Virtual Ability and their work and feel privileged to be here today as an introducer to one of their speakers. Thank you, Andy Cooper, for voicing for me as I was selective mute as a child and still suffer from some anxiety and needed a voice for me. It is a true privilege to welcome Erica Mones, and I hope I said that right, a bold voice and fierce advocate and a storyteller who challenges perceptions and uplifts communities. Erica is a YouTuber, writer, and disability rights activist whose work centers on visibility, inclusion, and authentic representation. Living with multiple disabilities, including cerebral palsy, Erica brings lived experience to her advocacy. Her blog, Running with Crutches, is a powerful platform where she shares personal reflections, cultural critiques, and calls to action, all with wit, honesty, and heart. Through her videos and writing, Erica dismantles ableism, amplifies marginalized voices, and invites us to reimagine accessibility not as a checkbox but as a shared responsibility. Her work has resonated across social media and beyond, inspiring others to speak up, lean in, and build a more inclusive world. Please join me in welcoming Erica Mones, a change maker whose courage and creativity continue to move the conversation forward.
Hi, my name is Erica Mones, and today I'm going to talk about community and social determinants of health because a lot of people believe health is just exercising and eating a certain way and doing all of the things we've been told to do, but it's very important to remember that if you don't have your basic needs met, or if you're living in an environment or under certain conditions, it's going to be a lot more difficult for you to be healthy. Next slide, please. So what are social determinants of health? According to registered dietitian Christy ha, ha, Harrison, social determinants are the conditions under which people and the economic and social forces that shape our lives from birth and childhood through, well, she said working, but I changed it to adulthood because not everybody is able to work. Adulthood, aging, and death. Next slide, please. So here are the 5 social determinants. Well, quality jobs, because many people get health care through their jobs. So if they don't have a full-time job that provides health insurance, they may not be able to achieve optimal health, and also if they're not able to afford food or housing or get their basic needs met because they don't have a quality job, they're not going to be able to achieve optimal health. And then with education. If people aren't aware of how to be healthy and how to live their life in a way that will optimize their health, they're not going to be healthy. And that also intersects with quality jobs, because if you're under educated, you may not be able to get a job that has health insurance or pays you a livable wage or even has safe working conditions. And then with housing, if you don't live in a safe housing situation, or if you have no housing, you're going to really struggle. You're not going to be able to think about going to the doctor or what food you're going to eat if you have nowhere to live, or if you have no heat or air conditioning, depending on what type of climate you live in. That can really impact your health. And then with that comes safe environments. If you live somewhere where there's a lot of violence, that can cause a lot of stress, which can cause health issues. And then with healthcare, which I think is the most obvious that we all think of when we think of health. If you don't have insurance and can't pay to go to doctor's appointments, and you can't pay for your medications, you're going to really struggle. And also, even if you do have insurance, if you live somewhere where there aren't a lot of good doctors nearby, that's also going to be a barrier for you. Next slide, please. So all of these social determinants of health intersect with different identities and forms of oppression, because nothing exists in a vacuum. And this is not an exhaustive list, but some of the main intersections include ableism, racism, classism, homophobia, and transphobia, fatphobia, and misogyny. Because not only does oppression directly impact your health because of the stress and trauma that they can cause, but it can also be a barrier in in getting healthcare, because doctors may hold prejudices against certain groups of people, so that can impact people in that way. And next slide, please. So ableism, a quick definition of ableism is prejudice prejudice against a person based upon disability. And I would even add, even if somebody doesn't have a disability, if they're perceived to have some type of disability, they can also be impacted by ableism. And this can show up as symptoms being dismissed as part of one's disability. If you go to a doctor, say you have cerebral palsy like I do, and you go to the doctor because you've noticed swelling in your legs and you're concerned about it, and your doctor says, well, that's probably just part of your cerebral palsy, which could be the case, but it should be investigated further, especially if somebody is coming to a doctor with that concern and being like, this is not normal for me. and I'm kind of concerned. And also, a lot of exam rooms at doctors' offices are inaccessible. If somebody, if the room is too cramped and somebody uses a wheelchair or a a walker, they may not be able to even get in the exam room. And then, of course, we have those exam tables which are not accessible if you have some type of a mobility disability, whether you use a wheelchair or just have trouble walking and getting up. That's really hard. And there's a history of forced sterilization in the disabled community, and that history unfortunately continues to this day. It's a lot less than it was, but there are still people getting sterilized against their will. And inaccessible communication. If somebody is deaf or hard of hearing, they're going to need an interpreter, and although doctors are by law supposed to provide that, at least in the US, there may be times when they don't, or they may provide like virtual interpretation, which some people say does not work for them. And then also, this also goes into people with intellectual and learning disabilities, because if a doctor is using jargon or inaccessible language and is just describing and explaining things in a manner that the person does not understand, they're not gonna be able to know what's going on and know what the next steps are and what they're supposed to be doing. Next slide, please. So, also, racism is a major concern. When it comes to dermatological or skin conditions like eczema or psoriasis or even hives, a lot of the depictions in textbooks and online show how these skin conditions present on white and lighter skin tones. So if somebody only knows how these conditions look on lighter skin tones, if they end up having in this condition, they may not recognize it. And doctors are the same way, because they're being taught from these textbooks that only really depict white skin. So if a patient comes to them with eczema or hives or signs of lupus, like a butterfly rash, these conditions may be missed. And then there's also environmental racism. Black people and other people of color are more likely to live in proximity to chemical plants and factories and dump sites and other polluted locations, which can really impact your health in a devastating way. And sadly, there is still a belief by many medical students who this day, it's not even something just in the past, but there's a belief that Black people feel less pain, so they'll be given less pain medication and their pain will not be taken seriously by some doctors, which can cause a host of problems. And there were also things like the Tuskegee experiments, where they told people they were going to treat them for a certain illness, and then they didn't, and just watched the illness play out to see how it would impact the human body. So there's a lot of history of fear and mistrust within the Black community specifically, and also other communities of color. And that fear and mistrust is warranted, because they've seen what has happened in the past and how they've been treated like human guinea pigs instead of people that deserve adequate medical care. Next slide, please. So also misogyny shows up here, and there's a lack of research on how conditions affect those assigned female at birth, or a- AFAB people, things like endometriosis, or even even getting away from health care for a very long time, up until fairly recently. Things like seatbelts and airbags were tested on people without breasts. So if somebody had breasts, they didn't know if an airbag or a seatbelt was going to adequately protect them. And there's also this pervasive belief that people assigned female at birth are hysterical or attention seeking, so doctors may not take them seriously when they come to them with a concern. They may say, "Oh, this is all in your head," or "just calm down." And then some symptoms will just be attributed to the menstrual cycle. They'll say, "Oh, that's just your period," when it's not normal to be in excruciating pain, even when you are on your menstrual cycle. But a lot of doctors, since it really only affects those assigned female at birth, it won't be taken as seriously. And those assigned female at birth also tend to be responsible for childcare and homemaking, so they may not have time to go to the doctor, or even have time to take care of themselves. They may not have time to eat proper meals, or to exercise and socialize and do all of the things that will help them to stay healthy and stay well. Next slide, please. And fat phobia can also impact the healthcare somebody receives, because a lot of people in larger bodies report that if they go to the doctor for something like a broken leg, their doctor will tell them to just lose weight. And there's also a lack of awareness of how eating disorders can present in larger bodies. If somebody who is originally in a larger body loses a significant amount of weight in a relatively short period of time, their doctor may praise them and congratulate them, whereas if they had originally been in a smaller body and they lost that same amount of weight in that same amount of time, they may be screened for an eating disorder or even things like cancer, which can cause rapid weight loss. And there's also the belief in society at large, which also a lot of health professionals share, is that people in larger bodies are all lazy and they have no self-control. They may falsely assume that somebody who's bigger does not exercise or they're always eating fast food when somebody may still be eating a balanced diet and moving their body, but they may just be bigger. Next slide, please. And other factors also can impact health, like transportation gaps. If somebody lives in a remote area and they just don't have access to reliable transportation, they can't go to the doctors or go to the grocery store or even get out and socialize, and that can really impact somebody's health. And of course, healthcare gaps. If somebody doesn't have insurance or they don't live close to a good doctor or a good healthcare facility, their health is going to suffer. And there's also, like I mentioned early, a major mistrust of the medical system, and for good reason. Next slide, please. Next slide, please. So, health justice is social justice. Nothing exists in a vacuum, and until we address these systemic issues within our healthcare system and just within our system at large, because even just thinking about where people live, and if they live in proximity to a grocery store, that's really going to impact their health. But until we think about this and start addressing it, then health will only be attainable for those with privilege, whether that be they're of a higher social class or they're white or they're non-disabled. Next slide, please. And so here are some concrete steps that you can take to help with this issue. And sorry for those who don't live in the U.S., but it was very difficult for me to try to find how this is done in every single country around the world, because I don't know how every system works. But if you live in the U.S., you can call your senator or representatives. And one thing that I would keep in mind is personal stories can be very powerful. Sometimes just using the generic, like people need healthcare, is not always going to make as big of an impact as if you have a personal story. For instance, one of my very close friends recently passed away due to years of neglect in the healthcare system and living in a very unsafe environment. And I really believe if he had gotten the care that he needed, and if he had grown up in a better environment, he might still be here today. You can also join a mutual aid hub, which is where people will go and help out other people. They may, if they're able to provide food, they may do that. And someone may also be like, I've got transportation, so I can help out with that. And it's basically just he's a reciprocal relationship where people in a community will help their other community members, and also fighting for relevant social justice issues, because like I mentioned before, none of this exists in a vacuum. It all intersects, and all of these issues feed off of each other. So until we address all of them, it's always going to crop up somewhere. Next slide, please. And this is just the list of resources I used to put together this presentation. I read two books in particular by registered dietitians. I read The Wellness Trap by Christy Harrison, and then I read Live Nourished by Hannah Spence. And what I like about both of these women is they go into the social issues. They don't just talk about, oh, eat this and you'll be healthy, or do this and you'll be healthy. Hannah Spence in particular talks about when she first became a registered dietitian, and she was working with this one woman that doctors were saying was very stubborn and non-compliant. But then when she talked to her, she asked her why she wasn't eating a diet that would support her health, and she said, I just eat the food that the homeless shelter provides. And no doctor had asked her that before. And so that's something that people need to think about. And if you look at my feet, there's a box there with the list of resources that I've provided in these last two slides. Thank you so much. And now is the time. If you have any questions or comments, please add that.
Erica, this is Gentle. Your information was a great introduction to the conference theme.
So the question I'm seeing is, I've lived in different parts of the U.S. So do social determinants of health differ across the U.S.? So for context, for most of my life, I grew up in New York, and then when I was in college, I went to school in Baltimore, and last year I moved to Wyoming, and so I definitely have seen different barriers to health. Like right now where I live, there are certain places in Wyoming where people will have to travel miles and miles, like a very long time. Some people will have to drive up to 2 hours to see a doctor, which is a big problem. And there's also, at least here in Wyoming, a lot of people mistrust doctors just because they just mistrust the system. And there's this whole idea of the rugged individual that pulls themselves up by their bootstraps. And so some people will unfortunately not seek medical care when they need it. And then in New York, a lot of it is poverty and not having in, insurance, and the same goes for Baltimore, because even though people in these cities live in proximity to medical care, if they don't have the money and the resources, they're not going to get the care. And if they don't live close to a grocery store, they're not going to be able to get food. Are there any other questions? So no, no, now Mara said, I spoke with a friend in New York City who pays $2,000 per MS on an ACA plan. For 2026, it'll be 2,400. Average people, let alone those with disabilities, can't sustain that for insurance. And definitely, it's definitely just out of control. People, people can't afford that much. I even have a full-time job, and that would be a very big part of my paycheck. And then I would be like, how am I going to afford both food and rent? And then Luke said, I agree that nothing exists in a vacuum. Your dietitian example is powerful. The current fashion or tendency for medicine and have become ever more and more specialized is also adding to this problem. And yes, exactly, because if you have to see 10 different doctors for the same condition and you don't have decent insurance, that's gonna cost so much money. And think so then Angela asks, is it important for people with disabilities to blog about their lives, and what disability blogs add to advocacy? Yes, it's definitely important in every way for disabled people to just be out there and to just show themselves and show that disability is a natural part of the human condition. I really like he Brown. She's a writer with cerebral palsy, and she talks about a lot of different issues, and also, of course, Alice Wong of the Disability Visibility Project is a very great advocate and really uplifts other voices. And it's just really important to be out there and to exist loudly, because in a world that doesn't really want disabled people to exist and to thrive, it's really important to be like, hey, I'm here and I'm not going away. Are there any other questions? Thank you so much for a relevant and engaging presentation, Eric. Oh yeah, and then Hi Sky said, gentle has been known to say that most people are TAABs or temporary able people because everybody experiences disability at some point in life. And yeah, it is very important to remember that disability is just a natural part of the human condition, unless you die really young in like a tragic accident, then you're probably going to, at the very least, age and experience that natural a- aging process, which includes reduced mobility and reduced abilities. But people can also get things like cancer or sustain an injury that causes them to be disabled. And Hideko said 1/4 of Americans will get some sort of disability before age of 65. And yes, and then I don't know the exact statistics for after 65, but it increases a lot, because after 65 you're aging, and that will just increase your chances of having some type of his ability. Are there any other questions? So McMillan says, Edigo, that depends on what you call disability. Exactly. Everything depends on your definition and how we perceive things. If you are diabetic and you don't view that as a disability, then you're not going to see yourself as disabled, where somebody else who's also diabetic may call themselves disabled. And Ice Guy said, I'm actually puzzled by people who have this attitude that people who acquire disability are suddenly of less value to society. Yeah, I know it's really hard for a lot of people that acquired disabilities, especially people I know have said suddenly they're just treated differently. And then Dr. Henry Germain McCarthy said even while still a temporary able body, many folks get get a sudden intro with disability when a close loved one acquires one, and that typically opens their minds to the injustices and inequities in systems of care and public attitudes. Even me, I've been disabled my whole life, but even when I go to New York City with my family members and they see how inaccessible some of the sidewalks and curb cutouts are, they're like, oh my god, I never thought of this. And I'm like, I've been disabled my whole life and you've known me my whole life. And you're just finding this out now, but it is good that they're still noticing, even if it takes something like that to get them to see. Oh, and then Gentle added the link to my blog. Are there any other questions? So how much time do I spend blogging? And that depends because actually earlier this month I was writing something that's gonna be published on another website in July. That it took me a few days because so my writing process is like I'll just have a bunch of ideas and I'll just write them down, and then after I do that, I make sense of it and I go in and edit it and make it something readable where somebody else is able to understand my thought process, because obviously nobody besides me is in my head. So even if something makes sense to me, they may be like, what, you just have a million different ideas and they don't go together. So then I have to make them kind of make sense, and yeah. Are there any other questions? And who is typing? I believe. So, History Rain asked, what impact has Second Life made on my ability to interact with other people? So, sadly, I haven't really used Second Life that much, but I do see just the internet in general is a really good way to meet different people around in the world, and to be exposed to new ideas, and also to just even people I know in real life. Since I moved across the country, I don't get to see them every day, so I'll text them or I'll call them and FaceTime them, and that makes it better. So, Luke asks, the official definition of disability is what is followed by institutions and agencies of support. And so, how do I think he can get them to see that disability is more individual and less generic, and that it may be gradient? How do we get the two perspectives to come together? I think a lot of times this comes down to speaking with people on an individual level. One thing I really liked about college was I was able to interact with people that had different majors, and I got to really talk to them about disability, and even people that planned to go into the medical profession. I would kind of tell them my story and how the medical system has impacted me, and the how the way that the medical system views disability impacts disabled people, and how people in medical professions really need to listen to disabled people and not just be like, well, I went to school for this and I'm the expert and I know more than you. It's really about listening and talking to people, even just on an individual level, because even if you just change one person's perspective, then think about all of the people they interact with on a daily basis. So Hideko said, several years ago I spoke with a medical school class and I used the line, I don't make myself disabled, other people make myself disabled. Make me disabled. And yes, that's the social model of disability, is that disabled people are not necessarily disabled inherently by their conditions, but they're also disabled by the environment around them and how people perceive them. And that's speaking with a medical school class is a really good way of impacting people and creating that change. Are there any other questions? So Handel said, thank you for joining us today. This was really helpful to hear, even if a little scary. Thank you so much, Handel. It's really good to work with you again, and I think this is a really good community that you've built, and it's great to see. Thank you.